I am delighted to be here tonight, and I am very eager to tell you a fabulous story. And it's a story of success, and it's a story of American success. And I have to wear reading glasses. I'm so sorry. Some of you may have heard of the Millennium Development Goals, but in the year 2000, world leaders gathered to try to set forward some goals for improving the world. And what were they? A series of health goals, reduce poverty. There was a whole series of things that they that they put forward, and everybody in the world agreed to, up at the United Nations, these goals in the year 2000. One of the goals was to halt and reverse malaria. And in the last 15 years, I'm delighted to say, we have succeeded. Since the year 2000, 6.2 million lives have been saved from malaria globally. Now think of that. Think of 6.2 million babies. There's been a 60% drop in malaria deaths globally, and that's even as the population in the world has exploded. And at the moment, more than 100 nations are malaria-free. The success in fighting malaria in the last 15 years is one of the greatest success stories in the history of public health. Now, it's not over. About half of the world's population is still at risk of getting malaria. 3.2 billion people live in areas where malaria happens and happens quite often. It kills about 500,000 people per year, and about 1 billion people in the year, about 1 billion people in the world carry the malaria parasite. Some of them are sick, and some of them just carry it. But if you carry it, a mosquito can bite you and then carry it off to someone else who may fall ill. And that means that the mosquito is the world's deadliest animal. And I have to call out here because we go to the beach in North Carolina, and I know last year there were a lot of shark attacks, and people were very concerned about that, but take a look at the shark versus the mosquito. This is something that is of much greater concern to humanity, and we have in front of us a historic opportunity to take care of the malaria mosquito. We have new tools, we have new knowledge of how to implement malaria treatment and control. We have the broad support of a coalition, and I'll talk about some of the partners in that coalition now. And we're ready to move forward on this. In the short term, and again, I'll get into more of this later, this is the list of countries where we think we can eliminate malaria in the next 10 years. And we can end this disease within our generation. Now, many in this audience may know that this is not the first time that the world has made a bid to end malaria. So in this lecture, what I'm going to do is I want to show you where we are now and why it's more possible than ever to eradicate malaria. I'm going to give you some history of the disease and a bit of background on some of the past efforts to control malaria. Some successful, some not so successful. And I'm going to talk to you about the seminal role of the United States government in this, including recent developments in malaria control and foreign aid from the George W. Bush administration on. This is something that I know a lot about. As the governor mentioned, I've done a lot of work in Washington, D.C., and have been immersed in the foreign aid world up there. And now it's more possible than ever to eradicate malaria. So I'm going to start with a little bit of Malaria 101. You all may already know this, but I think it bears repeating, and I have some really cool slides for you too. So the mosquito, the Anopheles mosquito, is the one that transmits it. It feeds on blood, and this one's nicely engorged there. And once it takes a bite of you, it can transmit in the Plasmodium parasite. Now, people think of malaria as being a tropical disease, but that's actually not true. Here's some pictures of where the disease has been a problem in the past. In Russia, specifically the Arctic Circle. Back in the 1920s, one of the largest outbreaks ever happened in Russia because there was a big drought. People migrated away from their homes, and they went to get work in other areas, places where there was malarial parasites. When the drought ended and their rains came, they migrated back to the Archangel region and the Arctic area of Russia. And then they brought the malaria parasite with them, and it was just one of the biggest outbreaks ever. Similarly, here's a picture of the 1860s of where malaria popped up, where it was present in the UK. And here's a picture of where malaria was in the United States in the 1870s. So here are a few more fun facts on malaria. 8 US presidents had malaria, and these include George Washington, Teddy Roosevelt, and Abraham Lincoln. The so-called autumnal fever was something that plagued Baltimore, Washington, D.C., New York, and Philadelphia in the 1800s. And it was so prevalent in the late 1800s in Washington, D.C., that there was a short-lived political movement to erect a giant screen around the District of Columbia. Now, I can imagine there are some people that would want to do that today for entirely different purposes. But what it does when it gets inside of you is it injects this parasite, Plasmodium, and it goes into the liver. And in about 10 days, it pops out from the liver and goes into the red blood cells. And here's what it does to the red blood cells. It explodes them. And then the parasites migrate into other red blood cells, and they explode other red blood cells. So you have like a series of bombardments going on inside of you, which leads you to get anemia and have a fever. It leaves you with fevers and chills and headaches, and it leaves you greatly weakened. And then once you recover from that, another 2 or 3 days down the line, you have a whole new round of the same pattern. In malaria endemic regions too, and this is something that I only learned when I got involved in global health work, you don't just get malaria once or twice. I traveled to Zambia one time, and I was talking to a nun who came down with malaria while we were there. And I asked her, so how often have you had malaria? And she's like, I don't know, because people will often get it several times during a season. And so if you think about the disability, it's not just death, but the disability and the work that's lost during the time. If you're getting it 2 or 3 times a year, year after year after year, it's incredible burden on life and livelihood and your economic productivity. But and 80% of malaria deaths come from anemia because it's exploding these red blood cells. But this is who's most vulnerable. Babies. Children, babies, under 2. Because when they're born, they have some immunities from their mother, but they quickly lose those immunities, age 4 to 6 months. And then if they start getting this Plasmodium coming into their systems, they die of anemia much more quickly. You get a certain amount of immunity to it, so it's especially young children and babies who are most vulnerable to dying from it. Another thing, malaria accounts for 50% of all hospital admissions in Africa today. Think of that. Think of if in the United States, 50% of all admissions were due to one disease, to malaria. And it accounts for 30 to 40% of all the costs of outpatient care. It is a huge burden in Africa. It can also be treated with 20 cents worth of drugs. And it can be prevented with a $6 bed net. And one of the problems is if you start a program, as we have, and then you have stockouts, then it comes resurging back. When I was in Zambia, I met with a malaria expert who had these graphs. They'd had a shortfall of bed nets. Something had happened in the supply chain. The bed nets hadn't come in. And there was a very clear one-to-one correlation. The bed nets didn't come in, the malaria deaths spiked, bed nets arrived, and they fell back off. And if you have children who have been protected by bed nets or treated by drugs, they have lower immunity altogether. So if you stop the program, or if you can't get the bed nets in, these children are more vulnerable and more likely to die than if you hadn't had the program at all. So it's really important to continue these programs. And the incidence of malaria is also something that is abetted by social disorder, by water flows, by water pooling. So that's really important when it comes to climate change. And again, by immunities or not to malaria. Now, as noted about a century ago, malaria was endemic, and it was a leading cause of death in nearly every nation on Earth. And it had long been recognized that there was a swamp or water connection. People didn't know exactly how malaria happened, but they knew it came in swampy areas. So humans generally moved away from those swampy, wet areas. There's a great part of Italy called Paestum, which is in the southern part of Italy, and it actually became depopulated. It was a fabulous place with columns and great archaeological stuff. It's still down there. But a few hundred years ago, malaria took over the zone and people just moved out and it was lost. People forgot that there was even this archaeological stuff down there. And only when they started to get malaria under control did people start repopulating this area. And so if you're ever traveling to Italy, don't just go to Pompeii and Rome. You should go down to Paestum because you can walk around in fields where it's nothing but grass and archaeological finds, and you can just tromp on them. It's really spectacular. Great stuff. So in addition to avoiding swampy areas, humans had also long used quinine and an artemisinin extract from trees. For hundreds of years they've been using it. In particular in China, they knew about the artemisinin. But in 1880, a French army surgeon discovered the malaria parasite, and that made a much finer point about how to attack this disease and what to do with it. And in the 1900s in America, the desire for commerce and the desire specifically to create the Panama Canal drove one of the first major efforts to control malaria in the Americas. So Teddy Roosevelt was desperate to create the Panama Canal. The French had tried and the British had tried in the past, and they had far too many workers dying of both yellow fever and malaria, so they stopped. It was a money-losing proposition, so they cut it off, but Roosevelt was determined that he was going to push this forward. So he hired a guy named John Stevens, who had helped to build the Great Northern Railroad of the Pacific Northwest, and he set him on the task of taking care of malaria and yellow fever in the Panama Canal zone. Now remember, there were no modern drugs, there were no modern pesticides, so he just had to control it by controlling water and other sanitation things. So he enlisted sanitation experts, he fumigated houses, he got rid of standing water, and he cleared brush in and around the canal. He drained 100 square miles of marshes, poured kerosene on the water that remained, and gave workers quinine and screens for their windows. And the death rates from malaria fell. Between 1906 and 1909 in this area, from 11 people per 100 to 1.2 people per 1,000. And the Panama Canal was built. And it was called the greatest sanitary achievement the world had ever seen. And along the way, they got rid of yellow fever too. About 5 years later, there was a push for malaria control domestically. The US Public Health Service was in effect between 1914 and 1924, and they wanted to control malaria, especially around US military bases and in the South. Now, you all may know, here in the South, many wealthy planters would escape during the fever season, and they would go up to places like Newport, Rhode Island, so that they wouldn't get malaria. But that didn't help anyone who was remaining in this zone. One study of farm labor and losses in 1914 showed that on one Louisiana plantation, 75% of families had at least 2 members have a serious case of malaria during the crop season. In another, a county parish in South Carolina, 86% of the population died before age 20. 33% of the girls and 50% of the boys died before age 5. And whites were hit harder than African Americans because they had less resistance to malaria. So this was really significant. The effort to take care of this was a very significant thing. So the effort went from being the Public Health Service to the malaria control in war areas in the 1940s. Here's a picture of that. Again, it was around war zones because they were trying to train troops and they needed to be able to train them year-round as we were approaching World War II. And then in the Tennessee Valley Authority effort, it was the same thing, using various controls to try to control malaria, and essentially got rid of malaria around the TVA area. But after that came the advent of biomedicine, antibiotics, drugs, and pesticides. It was a great era in the development of medicine. And in the run-up to World War II, there was an even greater need to protect troops in tropical environments, and DDT was discovered, and it was applied to the war effort. And here are a few real, I think, cool pictures of the malaria control around World War II. So advances in the past in malaria were driven not only by technology, but by active political interest and some other economic interests, political interests, military interests, and most of all, high-level political engagement by the likes of Teddy Roosevelt and Franklin D. Roosevelt. After the effort in the United States, there was an effort to take the malaria fight globally. And the World Health Organization, because they had DDT in their hip pocket, had a tight focus on Asia, but they decided that they wanted to eradicate malaria globally. So here's a picture of the work that they were doing in Taiwan. So it was like a military campaign. They pursued this intensively for 15 years. The emphasis was on drugs and pesticides, but it was just a limited number, and they didn't take into account resistance to the pesticide or the drugs. So by 1969, 56 species of the Anopheline mosquitoes had resistance to DDT. So even though they had really good experience in cutting back on malaria, it came back pretty quickly once the money fell off. After 1969, there was donor fatigue. There was a reorientation towards donor programs into things like polio and family planning. The money for the malaria eradication program plummeted. And while a few more countries were eliminated or had malaria eliminated after 1970, it came roaring back. In this chart, you can see that there was a very high level of malaria in Sri Lanka. And then by 1963, it had gone down to 6 cases. And then it went back up to 1 million cases in 1968, and then has gone down since that time. So it roared back, but it didn't get back to the same levels that we had before. And the reason that it dropped off is because the governments kind of gave up on it and headed in a different direction and stopped pursuing malaria. So that now brings us to the recent history and the opportunity in front of us. So, and I'm going to go on a digression here when I talk about AIDS, because I think it's really important to bring you up to where we are today. I've been working in Congress for about, in and around Congress for about 30 years. And I joined the House as a legislative aide in 1986. And when I was on Capitol Hill in 1986 and for the next 15 years or so, there was virtually no interest in foreign assistance. I mean, the people who were on the committees and dealing with it, they were interested, and they wanted to do things, and they wanted to extend America's reach and improve things overseas, but they didn't really have any domestic constituency. If you want to talk about appropriations, and the money for foreign assistance was in an appropriations bill, and it was in an appropriations bill that included courthouses and roads. The Commerce and Justice and State Department appropriations were all in one lump. So if you had a bill that had foreign assistance and you put it forward on the House floor, there were members of Congress that were willing to vote and to push the appropriators to make sure that there was money in there for a courthouse or for a road. And maybe they took that money from the State Department and put it into that other thing that's more domestically sort of supported. But there was no domestic constituency for foreign assistance. So it was always kind of like moving along. I mean, during World War II, it was important, and people put money into the Marshall Plan afterwards and so on. But after that, it kind of fell out of favor. So when I was working initially on Capitol Hill, foreign assistance had no real oomph, no real backing. Then came HIV and AIDS. Now, of course, it didn't start out as an international issue. we had gay men in the United States dying of a disease, and nobody knew what it was. And there was nothing any doctor could do. If you walked into a doctor's office with AIDS in the 1980s, you had a death sentence. All they could do was hold you as you died. And there was a whole generation of physicians that experienced that and watched that unfolding. And it was a huge liability, because as the AIDS victims came to realize that either they could share their identity as gay and come out and press the government to do things, or they were going to die, clearly the choice was take to the streets. So again, in our democracy, they could. They took to the streets. They took over buildings, they occupied the NIH, they waved their flags around, they got arrested. It was an incredible movement here in the United States that was protesting the government's lack of action on HIV and AIDS. And it became a domestic liability. The activists took aim at George H.W. Bush. They put a condom over Jesse Helms' house. They occupied the NIH's offices, and the US government responded. Did anybody here see the Dallas Buyers Club? The movie where no one was paying attention, and anyway, the US government basically, though, did respond. They invested in the drugs, they invested in prevention, and in 30 years they went from having virtually no way of dealing with HIV and AIDS to having 30 drugs that you could take that could basically extend your life from a certain death sentence to a close to full life expectancy. But the US activism around AIDS didn't stop there. Okay, so these guys had created momentum, and they were up on Capitol Hill, and they were occupying things and taking over the White House when they could. But they also really wanted to extend these drugs globally. And when George W. Bush came into office, he had a world where in Africa, AIDS was ravaging the population there. And he decided that he had to do something. And I listened to him give a speech down in Texas when someone was asking him about it. And he said, well, you know, why did you invest in AIDS? The program that he established was PEPFAR, the Presidential Emergency Relief Program for AIDS relief. And he said, well, I sat there and I thought, I'm pro-life. And if I'm pro-life, I'm pro-life. And if people are dying across the globe, then I'd better put my money where my mouth is. And I'm sitting at the top of the most powerful and wealthiest country in the world. And if I don't do it, well, then shame on me. So he created this program, and he wanted to do something about it. So he called Tony Fauci from the NIH, and he didn't know exactly what to do because AIDS was taking over Africa, and there's not good health systems there. And he asked Tony Fauci to go back and think about it and report back in 2 weeks about what they should do. And he and his aides expected Fauci, who heads up the R&D side of things, to come back and ask for money for a vaccine or more investments for R&D and whatever else. And Tony Fauci did not do that. He came back to George Bush and he said, we can put money into vaccines, but that's going to take a couple decades to get anything, if anything comes out at all. But as long as people in Africa have nothing that they can do if they get HIV, there's zero chance that they're going to come into a physician to get treated or do anything to mitigate against the spread of the disease unless we get assistance to them. So he thought the only thing to do is to make drugs available to Africans on a broad basis. That's the only way that you are going to get people to come in, to get their diagnosis, to alter their behavior, to interrupt the transmission of this disease. And nobody thought it could work. At the time, there were a lot of people out there sort of doing, this is crazy, Africans are never going to be able to do it, and so on. But it has been a tremendously successful program. And along with passage of the HIV PEPFAR program, he created the President's Malaria Initiative, and he vastly improved and increased the amount of money going into tuberculosis. So it was this guy, George W. Bush, who put the money into AIDS, tuberculosis, and malaria, which leads us to where we are now, and leads us to this opportunity in time. It was the biggest expansion of US foreign assistance since the Marshall Plan, and it has been overwhelmingly successful. At the same time that George W. Bush was in office and doing these things, this man was getting ready to retire from Microsoft. And he had a number of people out there trying to get his money. He was being asked to make philanthropic donations to a wide variety of causes, and he didn't know what he was going to invest in. And he and Melinda did a tour of the world, and they were astounded at the deaths that were happening in Africa especially, but also in Southeast Asia, that nobody was paying any attention to. And he realized and saw that there were diseases like malaria, where for 20 cents you could treat the disease, or pneumonia, or diarrhea. I mean, there's a whole range of diseases that they invest in that nobody was paying attention to. And in particular, as he was trying to formulate, what am I going to do with this money? He's sitting on a lot of cash. I was saying earlier to Professor Nielsen that the donations that he makes in global health today are roughly equivalent to what the World Health Organization invests. But think of that. That's one person, one foundation, roughly equivalent to the WHO. But he realized that even with that amount of money, even with billions of dollars per year, it was only going to be able to make a tiny dent in any of these diseases like malaria. So what he did was he decided that he was going to invest in places where his money could leverage other people's money, market failures, governments. And so, for example, in market failures, if you're in tuberculosis, 1 billion people have it, many people die from it, but the pharmaceutical companies have zero incentive to invest in new tuberculosis drugs, because the people who have it are so poor that they can't pay very much for the drugs. So Bill Gates decided that he was going to set up a whole series of what he calls product development programs, PDPs, to invest in the drugs that no one else is going to fund because there's not enough of a market for it. So he set up all these little venture capital funds essentially for things like malaria drugs and diagnostics and vaccines and so on, to get that research several steps closer to marketability, so that then perhaps a pharmaceutical company might make a profit or a government might step in and take it up. So in addition to market failures, he decided, well, the other thing is he's got to make sure that he's going to invest in governments. Like he decides, I think this is a great investment, I think this can save a lot of lives, and then he turns and hires people like me. So my organization is essentially a lobbying organization in Washington, D.C. It's educational, it's philanthropic, but it's a lobbying organization. And what I do is I try to take Bill Gates' money and apply it in a K Street lobbying sort of way to convince people in the US government, in the State Department, in the White House, in the House, and then in the Senate, to put additional money into AIDS, TB, and malaria. And to give you some sense of the power of that leveraging, Bill Gates gives my organization $2 million a year. $2 million, we've got 10 people, pretty small organization. With that, for the last 3 years, I've been able to increase the US contribution to the Global Fund by $250 to $350 million each year. So $2 million of Bill Gates' money is leveraging $200 to $300, $400 million from the US government. And that indeed leverages other governments, because they see the US taking the lead and they follow along. So Gates helped to develop new technologies like this one, bed nets, rapid diagnostic tests, artemisinin and combination therapies, and a whole bunch of things in malaria that have brought us to the point that we're at today. And to bring the innovations to scale, Bill Gates has also been investing in the Global Fund, which is the organization that I really work for and on behalf of. Again, a little bit of a diversion. The Global Fund is based in Geneva. It's an organization that gathers money from the G8 largely, so America, from the UK, from Italy, from Germany and Japan, and then takes that money and distributes it to 100 different countries, and to invest in TB, AIDS, and malaria in the poorest and highest burden countries. And every 3 years, the Global Fund goes out with its tin cup and shakes the tin cup and says, how much money will you, governments, will you, the private sector, will you, Bill Gates, give to me to fight these diseases? We're in the middle of a replenishment year for the Global Fund right now. 2016, there's going to be the tin cup moment in probably September or October of this year. So it's a very important one. And the amount of money that is raised from the US and other countries will determine how far and how fast we can go in fighting AIDS, TB, and malaria for the next 3 to 5 years. Again, another detail about the Global Fund. The Global Fund provides about 20% of all international funding for AIDS, about 50% of all international funding for malaria, and about 80% of all funding for tuberculosis. So this is the game. And if you want to talk about malaria eradication, the amount of money that we raised this year for the Global Fund is going to be a seminal thing for whether or not we get to our goals. And here is a breakdown of the funding for malaria. So if you take a look at the far bar, what you can see is the Global Fund, which is the pale pink zone. That's a pretty substantial amount. But that's the USA, and the Global Fund is the blue one down below. So as you can see from that last chart, the US direct investments in the President's Malaria Initiative and the US investments in the Global Fund, which leverage other countries, those are the two, that's the bulk of the world's money for fighting malaria. So it's really, the US is right at the forefront of these investments. And these investments, as I noted, they were started by George W. Bush. They've been continued by President Obama, and they have full, and unusually in Washington, D.C., they have full bipartisan support in Washington, D.C. The left, the right, the House, the Senate, the conservatives, the liberals. Everybody's in support of these programs. Now that's a really unique thing in Washington, D.C. right now. And again, to get back to my original statement, the success in fighting malaria in the last 15 years is one of the greatest success stories in the history of public health, and it is a United States-driven success story. The scientific advances haven't stopped yet. There are a bunch of new products and interventions that are coming down that pipeline that Bill Gates and the NIH and the UK have been putting forward. There's likely to be a single dose treatment versus having to take the doses over several days and 9 pills. They're likely to have insecticides in wall liners, in paints, in eave tubes. There are new insecticides that they're developing, longer lasting insecticide-treated nets, and cheap, accurate diagnostic tests so that you can go in and find out immediately if your fever is from malaria versus pneumonia or some other disease, which means that you can have better treatment altogether. There are also vaccines in the pipeline and genetic modifications to mosquitoes. There's just a whole bunch of new technology that's on the cusp of coming to the forefront. And recently, Bill Gates and the UN Health Envoy, Ray Chambers, have announced a major malaria elimination initiative. Obama picked up on this thread. He spoke in his State of the Union address about the opportunity to eliminate malaria. And the United Kingdom last week just announced that they were going to provide 3 billion euros or pounds for malaria R&D and treatment and control in the next 5 years. So we're at a moment where there's a lot of big people, a lot of big political push ready to back an effort to eradicate malaria. It's going to have to be a multi-pronged approach. So we don't want to repeat what happened in the 1950s and have just one kind of insecticide and one kind of drug and then face resistance and a resurgence in the disease. So there's going to be a doubling down on all these alternate technologies. It's going to take cash, a doubling of cash in the short term, a tripling in the future. Right now, $3.2 billion a year is going into malaria internationally, so we need to get up to 6 and then up to 9 in the next 5 to 10 years. And as I noted, the Global Fund replenishment is going to be critical. Whether or not we get much money in that tin cup will help to determine how much we can fight it. And very importantly, too, new countries or countries are really assuming the responsibility for this. And one of the things about the Global Fund is the Global Fund does not have any boots on the ground. There's no Global Fund office. You could go to Sri Lanka or India or Sub-Saharan Africa and you will never see a Global Fund office. It doesn't exist. We work entirely through governments and through organizations on the ground. That means we're building the capacity there so that they can take on the mantle when and if we decide it's no longer our game, that we're going to shift our efforts to family planning or polio or something else. They will still have the capacity because this capacity will have been built up there. In the first phase, so again, it's an American thing. In the first phase, these two countries within the Americas are the target for eradication. These are the 5 countries which we can eradicate or by 2020 in Southeast Asia. And these are the countries in sub-Saharan Africa where other sub-Saharan African countries have already committed to joining with the global north to fighting malaria and eradicating the disease there. And the aim is to completely eradicate malaria within our lifetime. In the end, the idea is to shrink the map on malaria. So here's a map of where malaria was in 1900. A lot of red countries with malaria transmission. Here's a map in 1945, still an awful lot of red. Here's 2008, looking a lot better. 2015. Here's the goal for 2025. And ultimately, we want to get to no malaria. So I'm going to finish by showing you a video which was produced by the Global Fund, which is intended to gin people up and get them excited about investing in the Global Fund. And I hope that this technology works.
Well, I hope so too.
Well, it's time to start the show. Lost my heart and lost my soul. Now it's time that you won't know.
Malaria is a disease that is treatable, largely preventable. It could kill 1 million children this year.
Extremely drug-resistant TB or XDR. 85% of patients die.
With my time, which makes things worse. Lost in my love is cursed.
AIDS today is claiming more lives than the sum total of all wars, famine, and floods, and the ravages of such deadly diseases as malaria.
Dramatically and start writing the story of the end of AIDS.
Yeah, very good.